What happens when you have a Candida in your gut? This is a common scenario at our functional medicine clinic when we see a patient and we do a gut test and it comes back positive for Candida. What does it mean? Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. So when Candida, a type of yeast, overgrows in the gut, it can disrupt the balance of your gut microbiome, leading to a range of symptoms and potential health problems. Here's a closer look at what happens. It's very common to see digestive symptoms, and those are bloating, gas, and abdominal pain. Candida overgrowth can ferment sugars in the gut, creating gas and leading to bloating, cramping, and abdominal discomfort in general. The accompanying symptoms are diarrhea or constipation. Candida can affect bowel movements, causing alternating patterns of diarrhea and constipation as it disrupts the normal function of the intestines in general. Yet, there are patients with no obvious GI symptoms, and we'll talk about those cases in a few minutes. Meanwhile, let's talk about the nutrient absorption issues. Candida overgrowth can contribute to intestinal permeability, that is called a leaky gut, where gaps are formed in the intestinal lining. I'm simplifying it, of course, and that can allow undigested food particles and toxins to enter the bloodstream, potentially triggering immune responses and inflammation. In the same vein, malabsorption goes along with leaky gut and with Candida overgrowth, and they all together can interfere with the body's ability to absorb nutrients properly, leading to deficiencies in essential vitamins and minerals. Another consequence of Candida in the gut is weakened immune function. And this manifests as increased inflammation, as Candida triggers inflammation, and it can lead to symptoms like fatigue, brain fog, joint pain, skin rashes, etc. And as part of this weakened immune system, another manifestation is frequent infections. Since the immune system is constantly fighting Candida, it can become overburdened, making you more susceptible to other infections, such as bacterial and viral infections. So let's move on to now to non-GI related consequences of Candida overgrowth. But before we move on, if you are enjoying this video, make sure to hit that subscribe button so you don't miss any of my upcoming videos on a variety of medical topics. So let's move on. So let's look at other symptoms. So let's look at skin and mouth symptoms. You are, I'm sure, familiar with oral thrush. Candida can cause a white, thick coating on the tongue and inside the mouth, leading to sore patches and the unpleasant metallic taste. Also, another skin manifestation of Candida is skin rashes. An imbalance in the gut can lead to skin issues such as rashes, acne, eczema, seborrheic dermatitis, because Candida toxins impact the skin barrier. So now let's look at the neurological impacts of Candida, and those are more than cognitive symptoms. Let's start with the brain fog. Toxins from Candida, like acetaldehyde, can affect cognitive function, resulting in symptoms like memory issues and difficulty focusing. The other important one is mood swings and anxiety, since the gut microbiome plays a role in producing neurotransmitters like serotonin. A Candida imbalance may contribute to mood disturbances and anxiety. That's fascinating. So the next function of our body that is affected by Candida is hormonal. Candida overgrowth can affect estrogen levels, as it can produce an enzyme that raises estrogen levels in the body. And this hormonal imbalance can lead to symptoms like PMS, weight gain, and mood swings again. So, of course, we all want to know how to treat Candida overgrowth. First of all, by implementing diet changes. Reducing sugar and refined carbohydrates can help starve Candida as it thrives on these foods. The next step is to add probiotics. They can support healthy gut bacteria, helping to restore balance. There are also antifungal treatments, and some are conventional antifungal antibiotics prescribed by doctors in cases of severe Candida infections. However, there are also natural antifungals for overgrowth situations, and simple ones like garlic or oregano oil, for example, that can reduce Candida levels. The last but not the least, supporting digestive health in general. This means maintaining a healthy gut with fiber-rich foods and adequate hydration. This makes harder for Candida to thrive. So, in summary, Candida overgrowth requires a balanced approach, combining diet, probiotics, and sometimes medical interventions to bring the gut microbiome back into healthy state. So it's also very important to note that we are discussing here Candida overgrowth as it is related to chronic condition. So it's a Candida overgrowth in the gut. We're not talking about severe infections, for example, presence of fungus in the blood, which is fungemia. It's very rare, and you usually see it in debilitated patients, usually in the ICU, in the patients who are on the ventilator, and that's actually a quite a acute and emergent state that does require proper antifungal antibiotics. And there are also some other situations where the burden of Candida infection is high enough that it is imperative to use antifungal antibiotics. Are they completely safe? Of course not, because they can have some effect on the liver, especially in elderly patients because they're cleared by the liver. And it is important to check liver enzymes when those antifungal oral antibiotics are prescribed. However, in today's video, we're mostly focusing on the chronic conditions caused by chronic Candida overgrowth in the gut. And all of this video is basically about that because, again, in functional medicine, Candida overgrowth as well as bacterial overgrowth are very important contributing factors to a variety of medical conditions. I hope you enjoyed this video. Thank you so much for watching. Stay healthy and stay informed. Until next time, bye-bye.